Hello, everyone. I'm Dr. Jeffrey Kyle.
And I'm Dr. Alvaro Raimunde.
And today we're here with two very special guests from Sprout Dental.
Hi, I'm Dr. Katie Schlosser.
And I'm Dr. Christina Amato.
Pediatrics presents.
So today we're going to talk about pacifier use, bottles, and other non-nutritive, and non-nutritive sucking patterns in children and how they affect our teeth and our mouth. And before we start, make sure you like and subscribe to our videos if you enjoy what you're seeing, and please add some comments too if you'd like to hear some feedback.
And if you don't enjoy what you're seeing, tell your enemies, and then they can waste their time. I'll cut that out. I just thought it was funny.
So pacifier use in children, let's start there. So the American Academy of Pediatrics recommends pacifier use in kids up to, starting
around a month old.
And to help prevent SIDS. So we as pediatricians always support the use of pacifiers. Now, not all every baby will take one, and so people at home shouldn't think, I have to always give my baby a pacifier. But we tell them it's okay to use, but it can become habit forming, and after a while, can become a problem, right?
Yeah. So the American Academy of Pediatrics, like Dr. Kyle just said, they do endorse the use of pacifiers, but it's really like for bedtime or napping. Not if we're awake and alert and interacting with the world. It's mostly just to maintain that airway. They think is how it helps prevent the SIDS while they're sleeping. Just a little tidbit here as to why babies like sucking on pacifiers or their fingers or their hands. Every baby is born with what's called a rooting reflex. And basically what that means is whenever they feel something on their cheek, they're going to instinctively twist their head towards that stimulation and then try to grab with their mouth, whatever that is. And that's a survival instinct. That's how they learn how to breastfeed, for example, or bottle feed. And then they also have a sucking reflex, which is separate from the rooting reflex. And the sucking reflex activates whenever they feel something on the roof of their mouth. So anytime they feel something on the roof of their mouth, they're going to start sucking. Which is really important because I get a lot of parents, especially grandmas, saying, the kid's starving. Look, it's, I put the bottle in and they're drinking it. It's like, no, it's actually just a reflex. But it does cause sucking, does cause a very soothing and almost analgesic effect in babies. And again, that's a survival instinct. They want to, instinctively, they enjoy sucking because it leads to their survival eventually. But that's why pacifiers work.
And I think we start counseling our patients about pacifier use as far as starting to think it's time to calm down or move on from the pacifier, typically after 6 months of age, because the highest risk for SIDS or sudden infant death is from birth to 6 months. It can happen after that, but generally the highest risk is then. So after that point, it's when we start to introduce and talk about, it's time to start thinking about how you're going to get rid of that pacifier and move on. And oftentimes, though, it's difficult, and parents have a hard time taking it away. So I guess to you guys, the question would be let's just start with, okay, so what's wrong with having a pacifier, till you're 2 or 3 years old?
Or 6.
Yeah.
So, as the mouth starts to form at, birth through the toddler years, it's very, very malleable, meaning it's very plastic. So anything that is a constant force inside of that mouth, the mouth will start to form around it. So if you have a pacifier that long term, like you said, they're interacting with the world, the child is just walking around playing in their kitchen set with the pacifier, and that the mouth is being trained to be around that pacifier. Not all pacifiers are made equal. There are some that specifically that have counter forces on them. So there's, I believe it's called the Nubawub. It has that little, I'm sure others do as well, but it has that little stuffed animal at the end of it. And what that does is it creates this orthodontic force, this movement of the teeth, of the premaxilla, of all of the bones in the jaws. And what that will do is create this potentially open bite that you'll see on some kids. You're like, oh, that's a pacifier. Or, and so those types of pacifiers, creating that force is not an ideal situation. As far as the shape of the pacifier, that there's all different types. I don't know if you want to elaborate on that.
Sure. I mean, as far as why we don't want them using this pacifier or their thumbs is because they does often lead to what we call an open bite. And so what does an open bite mean for a child? It means that they can't close and swallow properly. They can't bite into sandwiches. They could develop a speech and articulation concerns. And also at some point that tongue, and we could do all this all together. So if you try swallowing with having this opening, what's that like? So what we do is we compensate by thrusting our tongue forward to seal off that hole and so that we can swallow properly. So now the child has a tongue thrust. So now that's a whole other, so again, we're just kind of going around in this vicious cycle. Well, they're not doing the pacifier anymore. Well, now they have a tongue thrust. And now we have to relearn how to swallow properly, how to speak properly. So we're trying to prevent all of this future care for your child so that they can speak properly, so they can swallow properly. And another big thing is airway, is that this is something that this sucking force, it's constantly pulling everything in. So it's narrowing all of this upper face. So if you have this narrowed face up through here, you're closing in all of that airway. And so that can make certain airway issues more concerning and more difficult to correct down the line. So these are pretty major things that we're trying to intercept. And it's interesting that you guys said 6 months, and I don't think our minds even go to 6 months because often we're not seeing these kiddos until age 1. But I think our big number is always 3. And the reason for that is because that's when things start fusing. So another kind of cool fact is that little premaxilla area, it's at age 3, it stops fusing. So there's no change from when they're 3 years of age to when they're an adult. So this is the same size here from when you were age 3. So that's when everything really starts fusing, and it's hard to correct that habit at that point naturally. If you can stop that pacifier use before age 3, then usually that mouth will adjust itself naturally just through normal swallowing and just compression of the tongue, pulling that palate back apart. Just normal growth pattern will correct itself over time. Of course, the earlier the better. And the main thing I always say is it easier to stop a habit on a 1-year-old, or is it easier to stop a habit on a 3-year-old? Rip off the Band-Aid, just get it done, And tidbit, when you do decide to get rid of the pacifier, I always tell them to go throw the pacifiers in a public garbage, because you will be rooting through and finding that pacifier. But it's a hard few days for sure. So I completely understand and respect the need for parents and sleep.
And
so
it usually only does last about 3 days, and then the kids do a lot.
Yes, I would say 3 days. And so I say, just get rid of the binkies, send them to grandma's for the weekend,
right.
Go somewhere nice, and it is. It really is. It's like, whoa, it was that easy. It was that hard, but that easy to correct.
And
that.
I can't underscore it. The earlier you do it, it's just so much easier.
Right. Yeah, they don't have that object permanence.
Right.
Mm-hmm.
Sometimes I even tell parents if they're to even try with some kids is if you poke a hole in the binky to release the suction out of it. Some kids won't want it anymore because they're not getting the soothing. It doesn't work all the time, but it's sort of another thing you can try.
And don't make these major changes on a weeknight if you have work the next day. Right. Don't make these pivotal decisions on a day that you have to function the next day. Do it on the weekend. If you're off all weekend, Friday night, binkies are gone,
Yeah, and if you're trying to break a habit where the kid is needing a binky because they're upset or they're crying and you need to make them a little bit quieter, I recommend if you are completely against eliminating all Binkies cold turkey, give them the Binky, but as soon as that kid calms down, take it away again, and then try to talk and distract the kid. I do want to piggyback on something Dr. Katie mentioned earlier about narrowing the airways and things like that. The other thing, other than potential sleep apnea issues or trouble breathing that can cause, is an increased incidence or an increased chance of ear infections in kids that are using a Binky. Studies have shown that that is a thing. And since we're talking about infections, we all know that toddlers are probably not the most mindful in cleanliness and hygiene. That Binky is going to be on the ground. It's going to be in dirty cups. It's going to be, in places you don't want to think about. And then they're going to put that right back in their mouth. So they're going to get community infections from that Binky. And then the other thing is a lot of parents don't think about cleaning the Binky regularly, and that could lead to like fungal infections.
I just thought of a good piggyback, a little segue into another thing that sometimes parents will do is when the Binky falls on the floor, they pick it up and they put it in their own mouth. And what's really very eye-opening, a lot of parents don't know that cavities are caused by a bacteria, and you can transmit that bacteria from your mouth into that child's mouth. So yes, you have fungus and so forth, but another important part to drive home is not only does your child need dental care, but making sure that you are cavity free in your mouth, because until you are, that bacteria can be easily inoculated. And as soon as they get that bad bacteria, they're headed towards developing cavities. So just another little point to hit home there.
Love it.
Also, don't dip the pacifier in
That's
anything
mean.
too. No,
Right?
I mean like honey, like sometimes.
Yeah.
I mean that's the other end
That's
of it.
really cruel.
But I mean sometimes I have parents who it's sort of like maybe old school. They'll dip it in.
Like if they're teething or if they're sick, they dip it in the honey and then that's not good.
That can cause cavities.
Yes,
Definitely.
very quickly.
All right, so we talked about some infections.
The
How-
fingers too.
Oh, the fingers.
Yeah, so along the same lines of this falls along the lines of what we refer to as non-nutritive sucking habits. So the finger, the thumb, it's very similar in what it can do to creating these malformation, the malocclusions of the mouth. It is just a little bit harder because we can't poke a hole in the thumb. We can't throw away the public bathroom. So it is unfortunate, and I know that there are some parents. I'm sure you get it too. Is they don't want to take away the pacifier because they're afraid they're going to replace it with a thumb or finger. So they want to wait until they're a little bit older, until they can understand. So I wouldn't encourage that. I would just still tell them to bite the bullet. And if it transitions, they transition,
I always tell parents that, kids past around 6 months of age typically use a Binky as a self-soothing or as a soothing technique. So teaching them how to self-soothe without the use of a pacifier is probably the best way to go about it. Don't rely on the Binky because it's easy. Like actually, talk to your kid and figure out what other ways they can use to self-soothe.
Once children start sucking on their fingers and thumbs, it gets very difficult, like as you pointed out, to how do you remove that, right, or stop it, and you really can't. And really, I never tell parents that they should be disciplining their children over thumb or finger sucking or taking their fingers out of their mouth, because that can lead to a lot of anxiety. And a lot of times those kids, when they're preschool age, will then go suck their thumb somewhere in a corner somewhere or hide, so that you're not going to really ever stop it. Putting any sort of bitters on the fingertips or putting some sort of nail polish on the fingers that are bitter, it really doesn't work. So I would never counsel a parent to do that at all. And a lot of times once kids hit preschool age, again, you're talking about age 3, and sort of that's your area of saying, okay, we got to be done. They then are around other children. So when they start seeing children that are not sucking their thumb, the peer pressure of saying, oh, I'm not going to do that anymore,
Right.
sort of naturally comes into play. So I don't want parents to get overly stressed out about, their 2-year-old that's sucking their thumb, because you just really got to just bear it with it at that point.
Yeah.
At Sprout, we do a lot of positive reinforcement. We have a thumb chart to help counsel our patients that are cognitively able to understand that, at 2, they're not able to understand that the thumb is not, or putting their thumb in their mouth is not good. So we do hand those charts out to kids that are able to understand, it's a month or 2 months, and it's days of the week, and every day that you just put your fingers in your mouth, stuff like that, you get a check mark, everything's great. At the end of it, you get a big reward. You get to go to Target, you get to go to, and that sticker chart mentality can be used for brushing your teeth, flossing. That's a really great way to reinforce these positive behaviors.
Yeah, I think oftentimes with discipline in children, that we oftentimes go after the negative behaviors and want to correct the negative behaviors, and don't oftentimes enough support the positive behaviors. And really, like you said, that's just the way you want to be, because it's less stressful.
Yeah. So just like changing your verbiage, instead of take that thumb out of your mouth when they're not, then you say, wow, what a great job you're doing not having your thumb in your mouth. So just kind of switching it a little bit, you're still accomplishing the same thing, but in a different, more positive way. I would say that for the thumb chart, we usually say like age 4 is a good time to start, not really before that. And if you do have a child who is really motivated, I have found at that time that there are certain polishes that are effective. Again, it is a negative reinforcer when you do that bitter. So you do have to have that child on board and motivated to be reminded. And if it doesn't work, if you can start to see your child getting anxious about, having that on their thumb, then it's okay just to not do it and just continue that positive reinforcement. But sometimes that has been helpful, and just amping it up just enough to serve as that reminder, because a lot of times by that age, it is really like an unconscious thing that they're doing.
Yeah, it's almost like biting their nails.
Yeah. So it can be helpful in those ways. And then like another thing that when you're earlier than that, the one thing that I've found that has been a little bit helpful with the thumb or the finger habit is a lot of times it's also associated with like the blanket or their taggy or something like that. So if we can get that out of the routine, because as soon as they get their blanket, this goes in. So if we can keep the blanket out of their hands, we can also maybe help to redirect the finger, just keep them not going into that mode, that habit they've been into forever and ever. So again, it's what works for your family, right?
That's right. Oh, this was a great discussion here, I think we had. So I hope everyone enjoyed listening to our talk today. Again, like and subscribe to our channel if you're enjoying what you're seeing, and make sure you give us some comments. And
so we're going to continue our next episode again with Sprout Dental with Dr. Christina and Dr. Katie. Next episode, we're going to talk about the most common oral pathologies, or the things we find in babies and toddlers and kids' mouths that may not be normal, and what we should and should not be worried about. So stay tuned.
thank you.
Thanks.
Thank you.